In this video, I'm gonna talk about several reasons why premature babies, particularly micro-preemies and extremely premature babies, should be fed exclusively using breast milk. If you are not familiar with those terms such as micro-prematurity, extreme prematurity, and prematurity, you can watch my other videos that deals with those topics. But let me remind you quickly. Premature babies are those babies who are born at less than 37 weeks. Full-term pregnancy takes about 40 weeks. Micro-preemie babies are those who are born at less than 26 weeks. And finally, extremely premature babies are those babies who are born at less than 28 weeks of gestational age. Given all what I just said, you can realize probably that micro-preemies and extremely premature babies will be born with very small birth weights and will be very sick initially. And that will make them needing prolonged hospitalization in an ICU. During that time, they will have a lot of different medical problems. Fortunately, breast milk is a type of milk that is easily available to those babies and can help with a lot of those medical conditions. As a reminder, I'm Dr. Wiśniewski and you are listening to me on my channel, YouTube channel, Neoped Edu. The only purpose for this channel is to talk about medical issues affecting premature babies, newborns, and infants up to 1 year of age. Let's get to our topic of the day. I will go over the list of most frequently cited reasons why breast milk is the best for premature babies. Number 1. We have data saying that premature babies who receive breast milk have lower rates of death. I don't think there is anything more important than that. It's always catastrophic and devastating news when we find out that baby dies. It's terrible for parents, families, and healthcare providers. Number 2. There is a data in literature indicating that babies who receive breast milk tend to have shorter hospitalization time in an ICU until they go home. It's extremely important for families and parents to take their baby home as soon as possible. And in fact, I always get asked 2 questions after each premature delivery. First one is, will my baby survive? And second usually is, when I can take my baby home. So even though I don't know exact date and I don't have good answer for that to parents, I usually tell them that there is something that you can do actually to speed up that process and take your baby home sooner. And the thing is for mother to start pumping her breast milk as soon as possible after delivery and provide that breast milk to her baby as a feeding. Because those babies tend to tolerate their feedings better, they grow better, they have less complications, and they usually go home sooner. Number 3. Babies who receive breast milk as they are feeding tend to have lower rates, lower incidence of NEC. NEC, also known as necrotic enterocolitis. It's a severe complication that occurs in some very small babies. And basically it's an infection of bowel loops in their abdomen, sometimes also leading to perforation. Those babies who are affected with NEC require to be placed NPO, which means they can't eat for many days. They are placed on antibiotics and IV fluids, and some of those babies even need surgery to correct that perforation of bowel loops. Unfortunately, not all babies affected by NEC can survive. Number 4. Babies who receive breast milk as they are feeding tend to require IV fluids and IV catheters for lower number of days. IV fluids and IV catheters, unfortunately, are associated sometimes with increased rates of infections and also have some other complications. So, if breast milk can provide that benefit that babies tolerate feedings better, they can achieve full feedings sooner, therefore they will not need IV fluids and IV catheters, that's extremely important benefit to them. Number 5. Babies who receive breast milk as they are feeding tend to have lower rates of late onset infections or late onset sepsis. Late onset infection is defined as an infection that occurs in babies after 72 hours of life. It can happen at 1 week of life, 2 weeks of life, 3 weeks of life, or even later. Number 6. We know that there is some data telling us that babies who receive breast milk as their feedings have lower rates of BPD. BPD, also known as bronchopulmonary dysplasia or chronic lung disease, is defined as oxygen dependence beyond 36 weeks of corrected age after birth. So some babies initially develop RDS or respiratory distress syndrome. They require to be treated with oxygen and ventilators, and then quickly they recover from that condition. However, some babies go into so-called chronic lung disease phase, and they require oxygen for a very long time. Some babies can't be weaned off the ventilator, and some babies can't be weaned off oxygen at all, and they have to go home on oxygen. We do know that babies who receive breast milk for their feedings most likely have lower likelihood of developing that BPD. And finally, number 7, babies who receive breast milk tend to have lower rates of ROP, or retinopathy of prematurity. Retinopathy of prematurity is a disease of premature eyes that can lead to decreased acuity, visual acuity in those babies, and in some instances even to blindness. Even if we screen those babies very regularly and we recognize development of that ROP and we try to treat it with medication or laser surgeries, still those babies tend to have visual acuity problems, or in some cases may go blind. So in summary, I want to emphasize that breast milk is the best. I have no doubt it's extremely valuable medicine. It's not only a milk, it's a medicine for those babies because it can decrease rates of severe complications affecting neonatal population and also can decrease severity of those complications if they occur in those babies. If you like this video, please click on the like button. And if you're interested in other topics about health issues affecting premature babies, full-term newborns, and infants up to 1 year of age, please subscribe to my channel and check out my other videos.